18 years ago, Ann Johnson suffered a stroke that left her unable to move and speak. Now, thanks to an amazing brain implant and smart technology, she can talk again using a digital character. In a recent study reported in the journal Nature, scientists placed tiny electrodes on Ann's brain's surface. These electrodes send signals from her brain to computers. Clever artificial intelligence, AI, algorithms turn these signals into words. After a short pause, a computer-generated character speaks Ann's words and shows her feelings with facial expressions. One of the researchers, Edward Chang from the University of California, San Francisco, said, "It's incredibly satisfying to see this technology working in real time. This development is a big improvement over previous attempts," according to Nick Ramsey, a neuroscientist from the University of Utrecht in the Netherlands. Ann currently uses a device that lets her type words on a screen by moving her head. However, this device is slow, only allowing her to produce 14 words per minute. Regular conversations happen at around 160 words per minute. But with this new technology, which Ann can currently only use as part of the study, she can speak at a faster rate, about 78 words per minute. The device understands what she intends to say with about 75% accuracy. This new interface is a significant improvement over an earlier version from the same research team that only managed to translate speech to text at a rate of 15 words per minute. In simpler terms, Ann had a problem where she couldn't speak or move because of a stroke. Scientists put tiny things on her brain and used smart computer programs to help her talk again. It's like magic. Now she can say more words in less time and even show her feelings on a computer screen. This is a big step forward, and it's much better than what they did before. Scientists and doctors are excited about it, and it's like a tipping point in this kind of technology. The new and improved system uses something special called an implant. It has 253 tiny parts called electrodes, and they're put on the brain in places that help us talk. A long time ago, before Ann had her stroke, these brain parts sent messages to the muscles we use for talking, like the ones in our throat, lips, and tongue. But because of the stroke, these messages couldn't get through like they used to. Now, a cable connects to a spot on Ann's head, and it carries these messages to computers. Then, something really smart called artificial intelligence, or AQOI, takes these messages and turns them into tiny sounds called phonemes. These phonemes are like the building blocks of words. The AI puts these sounds together to make full words. There's also a digital character that talks with Ann, and it looks just like her. They made its face look like Ann's, and they trained its voice to sound like Ann's by using clips from her wedding video. This character's face also moves and shows feelings, based on what Ann's brain is telling it. Ann had to practice using this special talking system for many weeks. She kept repeating the same phrases quietly over and over again. This helped the system understand what her brain was trying to say. During these practice sessions, the computer learned to recognize words from a list of 1,024 common words we use when we talk. Ann was dedicated and worked very hard during these practice sessions. She recorded as much as needed because she knew that her efforts would help many people with disabilities like hers in the future. It's like she's helping create a special device that lets people who can't talk easily communicate with others. In the end, hearing a voice that sounded like her own made Ann feel emotional and happy. This is a big step forward, and it's thanks to Ann's determination and the smart technology that's helping people with communication problems. In a recent study conducted by a group of different scientists, there's some truly exciting news to share. This groundbreaking research was published in the renowned journal Nature on the very same day. The study revolves around a remarkable breakthrough in assisting individuals who face challenges in speaking due to a condition called ALS, amyotrophic lateral sclerosis. It introduces a unique computer system that holds the power to transform their thoughts into written words. This extraordinary computer system exhibited an impressive ability to comprehend the woman's speech at an astonishing rate of 62 words per minute. To put that into perspective, it's pretty fast. However, it's important to note that, much like all magical feats, There were a few hiccups along the way. Approximately 24 out of every 100 words were not quite accurately transcribed. Imagine relying on a vocabulary of 125,000 words. That's akin to having an incredibly vast dictionary at your disposal. Nevertheless, scientists are brimming with hope and optimism. One of them, Frank Willett, who hails from Stanford University, envisions a future where individuals who struggle with speech will be able to engage in conversations just like everyone else. They will be free to express their thoughts and ideas, with others understanding them effortlessly. However, it's crucial to keep in mind that these cutting-edge systems have only undergone testing on a handful of individuals. It's akin to trying out a brand new game with just a couple of players. We can't be entirely certain that it will work the same way for everyone. Judy Illes, an expert who ponders the ethical aspects of brain science, advises against prematurely making promises that this technology will work seamlessly for all. It's possible that more time and refinement are needed to perfect these systems. Another factor to consider is the current state of these devices. At present, they are connected via wires, similar to the setup used by Anne in the study. This wiring arrangement isn't particularly convenient for everyday use. What we truly desire is for these devices to become wireless and compact, akin to something you can easily carry around. Fortunately, scientists are diligently working on this challenge. Their ultimate goal is to secure approval from the FDA, Food and Drug Administration, the regulatory body responsible for ensuring the safety and efficacy of medical technologies. Once this milestone is achieved, these communication aids could become widely accessible to all who require them, ushering in a promising future where effortless communication is a reality we can all look forward to. Don't forget to like and subscribe to our channel and stay tuned more.